Hey guys, I'm Sindhuja.
I'm Savni.
And I'm Suvan.
And you're listening to
Nothing's the same.
Today we have with us Dr. Anup Shinde. So could you please introduce yourself for our audience?
Thank you. Thank you. So I'm Dr. Anup Shinde and I'm Global Head for Occupational Health and Industrial Hygiene for Cipla. Okay. So basically we do have medical facilities to take care of all our employees, direct or contractuals also. And also something I take care of, okay, what is the effect of drugs and chemical on human body and how we prevent that or make everyone very safe to work in the plant. And I'm basically MBBS and a postgraduate doctor. Also have my specialization in occupational health and family medicine. I might have interest in medicine. That would be, heart disease, kidney, liver, lung also in COVID. So that's all about me. Yeah.
That's really awesome. So we're gonna ask you a few questions that we and probably half of our viewers have for you. So
So my first question is, how do you motivate, discourage patients or the uncooperative patients that basically approach?
Okay, thank you for that question.
Yeah.
Okay, so basically that is really difficult and there could not be very straight answer. It depends upon person to person. So it's all about motivation, capabilities and opportunities, motivate a person's behavior, okay, or patient's behavior. Okay, what do you mean by capabilities? Capabilities are both for the patient also and for doctors also. The capability of a patient, you do know now people do read on Google and then they come back. So they have, some some understanding regarding the disease, maybe some doubts also, and many things. So it's all about their capability and their understanding about the disease, and also about the capability of the doctor or the complete medical team and the facility capabilities to handle such situation. And when we convert this into opportunities, like, okay, if the particular facility doesn't have that type of support, okay, and if we could not give him the best, what is best for him, the patient should be in charge of taking the opportunities, what is best for him. And doctor's role is to explain him what are the capabilities, means what can be done here and what best can be done at some other places. If something best can be done for his interest in the particular facility, we should go ahead with that. And also at the time, he should have all the opportunity of understanding his disease, how it should be managed and everything. If we do that, this motivates patient, okay, to adhere to, particular treatment and regime and then everything. The one thing is with medicine is we need to have a human touch. We have to explain them. We have to patient with them, like you all guys, I think you are from engineering and management background, right? So
yeah.
okay. So basically, like many of your concept may be, very new to me. So same happens with medicine also. We have to be patient. Many times the question could be, very, it may feel that these are very basic question, but it may not be that basic with the patient.
Right.
So this is all managing opportunities and capabilities to motivate a patient to adhere to the medical treatment. This is how we can manage, uncooperative or unresponsive patient.
That was a really nice insight. So I'm pretty sure that you must have received a lot of challenging case studies, I guess, regarding your patients. So is it possible for you to describe your most challenging experience with a patient? And if you have, how did you really put yourself up to the challenge and go ahead through with it? If you could just describe.
Okay, I'll answer this question in two parts. Okay, the challenge was nobody knew what we have to do with COVID. Okay, it was a new thing and it came up in such a big wave that we never knew what has to be done. So the challenge is regarding the resources. Resources could be regarding manpower also, regarding the tools, having the machinery, right machinery with us. Okay. Yeah. Then regarding the procedures, how to do, means what to do, what should come first, what should be best for this type of age group of patient or different sets of patient. So these are really, really important. Okay. So our biggest challenge was we never know what should be the procedure. Okay. Now let me tell you ki, we started with contact tracing. Okay. So contact tracing means if a person is there, he can infect other person. So we know R naught for this COVID was 2.5. Okay. Like a COVID with a mathematical model can infect 2.5 people. Okay. And the good thing should be, we should minimize it to 1. Okay. Like one person can infect to only one person. And this is a good scenario. This we can control. So there was no procedure. Like if I have to decide what should be the distance between two people. We are not talking about the general population. We are talking about the essential services like pharma industry where people have to work. Okay, they have to provide the medicine. So what should be the distance where we can say this is the acceptable risk and we with the precautions we can go ahead. So procedures were not there. Okay, we have to develop the procedures with our learning, with the literature, with some of the experience here or somewhere else in the world. Okay, so that was it. And you can understand it was a difficult situation for retaining manpower, also retaining and recruiting many other people who are not from medical background. That becomes a bigger challenge. Then tools, machines, regarding mucormycosis.
Yeah.
The drug which we were using, which required in 3 months, that was the complete capacity for the 5 years.
Oh.
Okay, so you can understand. And Cipla was one of the part of it. Okay, so this managing was a bigger challenge. Okay,
Right.
so this is my first part. What is the biggest challenge is resource. Okay, managing resource. It's not only important that we develop the resource, but we have to cultivate the resource also.
Right.
Okay, like hospitals. One cannot be a super specialist in all the fields. Okay, sometimes a person, if he coming with the COVID, have a cardiac disease, a valvular disease, you need a cardiologist. You need to have a tools like what we talk, like a podcast we are doing, virtual thing. Okay,
Right.
this was very new in medical fraternity. Okay, so reaching out to a doctor, taking a thing, and then going ahead. These were the challenges. I think we are at some level, and we need to reach to certain level with this. And this was a great learning. Second part, I would say, okay, we know what happened with COVID. Okay, medicine crunch and everything. But one thing that we should be talking about, what is post-COVID and what are the after effect or byproducts of the COVID. Yeah. So I have seen children, okay, child obesity is a bigger problem. I've seen people, somewhere between, you say 13 to 16, reaching to more than 100 kgs. Yeah.
Right.
So this is a really a troublesome problem. Okay. And we need to have certain more engagement things and other things in future regarding such type of, estimating such scenario. One more thing that I feel that is really a bigger problem is, mental health. Okay, there is one term called as COVID psychosis. Yeah, so that affects and mental health is a bigger problem. We do always think about mental health as, it's always about stress. You understand, no? There are two terminology, eustress and distress. Okay, eustress means like before examination you can complete your book. Yeah, so that is all about managing the stress in a positive way. Yeah, so mental health is also about that. We need to incorporate mental health counselings, okay, having more interactions with our loved ones and understanding who we are. So that is one challenge that I saw, and these are the two challenges we need to focus in future.
Okay.
So yeah, that was a lot of new information for us to learn. And so we can go ahead with the next question. And this is a very general question, but what personally motivates you at work? Even like during the pandemic when everyone was stressed out, or like most of the people worked online. So were you able to accustom to the environment, and what motivated you?
Yeah, and I feel
Okay.
like more than the general population, I think healthcare workers faced the effects of
Yeah, the
COVID on
backlash.
the first line. So how did you actually go ahead with your work without feeling absolutely
Helpless.
helpless?
Yeah. Okay. Now this is difficult, not a simple generic question. This is the
Yeah.
most difficult question. Yeah. Okay, take it this way. All of us have something good in our heart. Like you guys, why you're doing it? Because this information, learning should be, available to most of the people so that they can face certain things. So we all have good in our heart. Okay. So what motivate me is opportunity. Okay. Having the opportunity that I can do something. Okay. I have that skills, it's all about skills, education, and my attitude. So I had that, but having that opportunity to apply it, it motivates me. Okay. Second thing, working in an environment where my aspirations, okay, to do certain things. I told you what I want to do, but working in an environment or an organization where my aspirations and their aspiration for well-being matches.
Right.
Okay. So that really motivates me. Okay. I want to do it, but if there is no condition for me to work, that will not motivate me.
Right.
So if I want to put it into, public health services, okay. So public health services also, we need to have that condition. During COVID, we all did a lot of CSR work. Okay. So I was asked what CSR we need to do because we were into bang of pandemic. So I told that we don't have to do it anywhere other than our public health services. So in one of the organization, I worked with oxygen system for the complete hospital. Okay. Then oxygen generator plant. When it started, before I'm talking about the first wave. Okay. Then there are many oxygen generator things. So there is always there for the criticality. If a person reach into criticality, for the middle layer, where if you don't do something and that person will reach to criticality, that part is always missing. Either there is normal or either there is a criticality.
Right.
But we need to have certain resources where we should act, okay, so that this big chunk will not land up into criticality. So that conditions will motivate. So if you could give this broadcast to many of the people or stakeholders where to enhance the public health system, that would be really great.
Something that is needed. I
Yeah,
agree.
it's required. Yeah.
Hope I have answered your question.
Yeah, very well. In fact, you want to ask the next question?
So now that this COVID-19 is almost over, how have the things that like you were doing before, like how have your methods of working changed, and do you still recommend people to wear a mask and stay cautious about their health?
Okay. Now this will be something very, very elaborative thing. Okay. So, okay. You understand genomes?
Yeah.
Genome? Yeah. DNA, RNA structure. Okay.
Yeah.
So basically this COVID is, RNA virus. Okay.
Right.
Positive stranded, single stranded RNA virus. Okay. So you say this is one sequence of, that particular amino acids. Okay. Then second sequence, and this all becomes one RNA. Okay. So there is number 1, number 2, number 3, number 4. You got it, no? So for this particular virus, there are 29,962 sequences.
Wow.
Okay. So let's goes to sequence number 5. Just think about that combination. If sequence number 1 goes to sequence number 5, the complete structure of RNA will change. Okay. Complete structure of RNA will change. It will define, like for a human, if we say our DNA changes, my hair color will change, my eyes color will change. Okay. My complete morphology will change.
Yeah.
So you think the potential of a virus to mutate. Right now, we have more than 1.5 lakhs of mutations worldwide. So yes, to answer your question, let's say cases are coming down, but there is no predictability. Can case increase, when they can increase, or there will be only mutation of COVID virus, or there will be some other virus also. Okay. So what we need to do is have certain respiratory etiquettes, hygiene etiquettes, and some environmental etiquettes. Okay. Like if I want to answer in this particular sense, okay, we may, like we are speaking, like you three are sitting there, the health condition, you can remove the mask. But if you are in closed spaces like public washrooms, okay, or somewhere in the public transport, you can still think about wearing a mask. Single layer mask is also sufficient. Yeah. So to answer your question, yes, things are changed, but we don't know how they will again reverse back. Okay, so better we adopt this system, this new normal to our lifestyle.
I think not just with respect to COVID hygiene, but I guess even in general, I think it's our responsibility to be really hygienic. Sorry, when we are in public, especially while using maybe you can say public transportations or like washrooms. I think it should be our responsibility as citizens to really keep our space clean so that we can actually completely avoid a contraction of any kind of bacteria or virus. So I think that should also just be set out here. I feel like it was important.
And also, Sir spoke about like mutating viruses. So I don't think a virus ever dies down. Like we had the Spanish flu, that didn't die down; it just became less dangerous.
Yeah, because people took a lot of precautions and took the matter really seriously. So I think even though we think that COVID is really dying down, it's just
a virus that is becoming less.
Yeah, it's just maybe us being more aware and precautious about the matter. So I think it's really important for us to wear masks.
So and also, sir, about the masks. Yesterday, Maharashtra government had announced that they are basically making a mask-free zone. So do you think that this decision taken by the government is advisable? Like, is it the right decision that the government has taken to allow
a zone free of masks?
Yeah. So what they said, if you could read the complete guideline and complete brief or press notes and everything, what they are trying to say is it is not mandatory. Now, see, let me tell you, there is always stage in public health. Okay. Earlier, it was one stage where it was all mandatory.
Yeah.
Okay. Like supervision thing. If you're not doing this, police is standing there. If you're not doing this, then there is a fine. Now we want to change it to a different level where self-reporting, self-reliance, self-motivation, these all things are there. So to answer your question, what they said is, they said that mask is not mandatory, but you are advised to wear the mask.
Right.
Okay. Yeah. So this is how we need to go further, right? Unnecessarily panic. We talked about mental health. Okay. We need to give hope to the people also. Yeah. Like we saw, there were some people who were, absolutely very, very carefree about the COVID. Yeah. But there were some people very paranoid. I knew some of the people who didn't step out of the house for, 1 or 2 times in this complete 2 years.
Yeah.
Okay. So probably this is what government want to say.
Right. Another question that I'd like to ask you is, did COVID
if you could allow one line, I want to summarize regarding you two definitely saying something. It's not that virus has gone. It's always about virus and human being making amend to live together.
Yes, exactly.
Okay. Yeah, they make the changes so that it will be harmful to the humans, but not to the mortality.
Right.
If you see complete history of virology, you will see that wherever the virus was of high mortality, it suddenly came down. It's all about equilibrium. Everybody want to live.
Right. So during COVID, what kind of respiratory conditions did you see the most as a result of COVID? Like, even if, so for example, if someone didn't have pneumonia before, but the minute they contracted the virus, they started showing symptoms for pneumonia, and that possibly led to a more serious, probably, aspect of the issue. So, what was the most, I don't know how to, like, dangerous respiratory condition that you have
Even like
observed?
many people were diagnosed with lung bronchitis.
Right,
etc.
yeah, as a result of COVID. Yeah, so.
Okay. So if I've rightly understood your question, you are asking what was the terminal sequelae that I've seen in the lung cases, right?
Yeah.
Okay. So it all was really bad in second wave. Okay. First wave also it was bad, but second wave it went really bad. Now you understand, this is my upper respiratory tract. Okay. From here it is upper respiratory tract, and here down it is lower respiratory tract, means lung per se. What is
Right.
into the lung? Okay. Second wave was all about getting into the lung. Okay. So all the infection were into the lung. So what happens with COVID is COVID acts on, the breathing cells. What is the breathing cell in our lung? In the last part of lung. So it acts on that. And whenever it swells that, there in the lung. Oxygen आ जाती है पूरा. And
Sir, I'm sorry. Could you just
what
repeat?
happened
Could you just
due to
repeat it
this?
again,
There were
because we couldn't hear
two
you?
conditions. One was process. Yeah. I think I've lost you for a few seconds.
Yeah,
Can you
could
repeat,
you just
please?
Yeah.
repeat like the last segment of whatever you said, because we couldn't hear you at all.
Yeah, the voice completely.
Okay. Okay. You have seen grapes.
Grapes,
Yeah.
You have seen grapes, na?
Yes.
Yeah.
Grapes. Yeah. So in our lung, at the terminal position, the alveoli, means the breathing space, they are like grapes. Okay. So what this virus was doing, it was attacking on that terminal part. When it was attacking there, it was causing inflammation. Sujan lata tha. Okay. Something making it, more watery. Means the water would leak into the lung. Okay. Outside. And due to that swelling, oxygenation will be low. Okay.
Right.
Oxygen cannot flow into the body, or carbon dioxide cannot come inside. So that was the bigger problem. So what we saw is, due to this, reduced in the saturation, which was not in this wave. Okay. Second, what we saw is, due to this, there was fibrosis. Means elastic jaisa tha, we plastic jaisa ban gaya. Therefore cannot expand. You got it? So that fibrosis was, reversible. And the third thing that we saw is, this was beyond repair. Okay. Body always have tendency to repair. It was beyond repair, and it went into acute respiratory distress. Means everything stopped. Okay. Required oxygen is not going inside. So as a doctor, what we should do? We should have a tool to early diagnose. Okay. So we should have certain tools to early diagnose. That comes with, certain, mathematical tools also, and certain experience also. So if you know, yeah, this person is susceptible, like having long-term diabetes, he had more chances to reach there, or a higher age group person. So we should segregate them. We should monitor them. Okay. And we can prevent, for this person to go into complications.
So,
Hope I've answered your question.
Yeah.
we were just like trying to soak in all the knowledge, because a lot of this is new to us.
Yeah, it's actually really interesting to learn about all of this.
Yeah.
It's like
I
very
like
much
comparing alveoli with grape. I think that's the first analogy I've ever heard. It's very intense. It makes like learning about it easy.
Yeah,
So
it
that
does.
is okay, so the next question is, so you are a healthcare doctor in a pharmaceutical company. So according to you, is that different to working in any other company, or like in a hospital? So do you think there are any differences, or is it very similar?
Okay. So let's keep hospital away. Okay. For discussion purpose. But healthcare is a essential health services.
Right.
Okay. Our main priority is, business continuity. because we cannot stop. If medicines are not coming out, it's going to be very, very dangerous, right? So you know the very big umbrella was manufactured by Cipla pharmaceutical company.
Yeah.
Okay, so our main role was having that business continuity. Okay, making sure that the virus, we can prevent the virus to transmit. Okay, if it transmits, we trap the transmission. We do have certain mechanism to trap that transmission. Okay, and third, there is post sequelae after the incidents. Okay, how do we do something to mitigate or contain the cases? Okay, that's what we discussed, like reaching to complications and everything. So this was one big challenge, what we have to do and how we have to do. So what we did, we had very stringent protocols, right from buses. Whenever buses were going, there was social distancing in bus. There was also vigilance. Okay, many people were coached to train people to wear masks, how to rightly wear the mask and everything. Also canteen, you can understand, canteen is the place. Like in bus I can wear a mask, but in canteen I have to take out the mask. Yeah, that is the bigger challenge, and everybody have to eat. Like at least one breakfast, one lunch will be there, or one dinner has to be there in canteen. So what we did to prevent this transmission, we had barriers in canteen. There was social distancing in canteen. Also there was time segregation. Like particularly if I have 10 departments, so this 1-2 department will come at 11:30. This will come at 12. This will come at 12:30. So these are all the things. Second thing, what we did is we tried to restrict the people interactions. Okay, wherever it is very, very essential, then only they will interact. Otherwise they will interact virtually. Okay, so this way we always knew, like if I'm in contact with you all three, okay, so if I'm getting positive, so rather than waiting for you to develop the symptoms, we already knew that you were in the contact tracing.
Right.
Yeah, so we used to trap them, treat them, and we could be in position so that you will not transmit it further to other people.
Right.
So that was regarding transmission. Now there were very difficult scenarios, like there are young guys, okay, temporary worker coming somewhere from different part of India, or different some town.
Right.
And what they will be doing is they have fixed salary.
Yeah.
So what they will be doing, they will be 4, 5, 6 people will be living in a room. Now imagine a scenario like one person is COVID positive or suspected to be COVID positive, came in contact. So we did have something for isolation. We booked hotels. Okay, we booked hotel. Whenever such person was there, this person was shifted to hotel. He was quarantined for the particular incubation period, tested. If anything is there, he was monitored for all these 7 days. Means we cannot test him, na, on the
Right.
first day.
Yeah.
I'll tell you about the testing something. So we have to wait for certain time, okay, for the incubation period, then treat him. So we used to check him in that period also, test him, and then take him in. So for the business continuity, many innovations has to be done. Help of this audiovisual technology was also useful, and there were certain tools that we used, like news protocol and everything. It gave a certain idea, like this
Right.
person is worsening, okay, and in advance we could tell our site people, site committee teams, ki, okay, I may require 4 hospitalization in 3 days.
Right.
Okay, there are chances that all these three people will not require hospitalization, or they may require it, but it will always be prepared, na, rather than being sorry.
Yeah.
Yeah. And we do have our own antigen facility. We did antigen inside. There were travel restrictions. So many things were there which were required for the business continuity, and that was done in a pharma industry. Probably may not have been done into many industries.
Right. Yeah, that's pretty agreeable. Yeah.
Okay, so I think we can go ahead with the last question.
I actually do have
okay,
questions. Okay, so I wouldn't consider this as myths in the medical industry, I guess, but there's this notion that the audience or the general public has, that maybe having a really positive mindset could really avoid a person from contracting any kind of disease, or maybe it would make it really easier to fight any kind of disease, irrespective of whether it's treatable or not. Do you think that it is absolutely true, or is it just a myth?
Okay. First of all, thank you for asking this question. Thank you very, very, very much. Okay. Now, please understand there are two types of diseases. One is communicable, like I can transmit to you.
Right.
Clear? And there is some diseases non-communicable, like I'm having hypertension, diabetes, heart disease, kidney disease. I'm not going to transmit it to you. Okay. Fine. When we talk about non-communicable disease, this is true. All good. Sorry. So all good. Explain this up. All good mindset and everything does help. Okay. It has certain good. Give you one example, like there is one tablet like serotonin.
Sir, we
Okay,
can't hear
Cipla and
you.
everything for mental health, we do it.
Your voice is really low.
Now?
No,
Now can you hear me?
it's really shallow.
Okay, okay. Can you hear me?
Yeah.
No, we can't.
Is it okay now?
Yeah.
It's fine.
Okay. So we are talking about communicable and non-communicable diseases.
Yeah.
That mood elevations and everything. So it creates certain chemical in our body which will help to elevate your mood. Okay. But do you know with aerobic exercise also that same chemical in the same quantity can be produced?
Okay.
Yeah. So good means this all positive thoughts and everything 100% it has measurable effect in communicable diseases, non-communicable diseases. Okay.
Right.
Now let's take example of communicable disease. Okay. Just for your understanding, I'm telling you like this. Let's say you have 2000 COVID virus. Okay. And transmit with 2000 COVID virus of friends, right? But if you have 10,000 COVID virus in you, then only it will be tested. The test will come positive.
Okay.
You got it? Huh?
Yeah.
Let's say for the argument's sake, when you have 5,000 COVID virus or 10,000 COVID virus, then only you will show symptoms. But for 2,000, you will be spreading to everyone. Okay. So with positive thought and everything, you will not have the symptoms, but you have the capacity to, transmit it to some of our loved ones. Hope I have answered right.
Yeah.
Yes, very.
Answered your question.
I mean, I have seen a lot of families. In fact, my family would be a very good example for the ideology that, "Arey, stay positive, nothing will happen. If you are just conscious, you won't get the virus," and all. So I thought it was really important for me to ask this question. Another thing is people really believe that vaccinations don't work, or they believe that vaccinations, I don't know, make a healthy person even worse, or vice versa. So what is your take on this subject as a healthcare professional? Yes.
Anything you want to add?
No, I was just thinking like, I don't believe in the whole anti-vaccine community. I feel like it's just, anyways, you can go ahead.
Okay. Let me tell you this way. Okay. Let's say you have a manufacturing facility.
Right.
Okay. Something is, manufactured and there are a lot of goods and there is always security, no? Okay.
Yeah.
Then people want to steal something. Some of the people, not all people are good. And just imagine a scenario. So what they will do, they will steal, they will keep it in their pocket and they will move out. Then after some time, security will understand, okay, these guys are taking in pocket. Yeah. And they will start checking the pockets. Then for certain time, nobody will be, uh, carrying from the pocket. And then security also forgets to check their pockets while people are going out, like frisking and everything. Yeah. Then this becomes a very problematic scenario. But let's say ki now and then security is coached. Ki this could be the scenario of the theft. Would it be good for that organization to prevent the threat?
Oh, wait,
Yeah,
prevent,
yeah,
Just do
I
it.
thought it's okay, never mind. Yeah, I could do it.
You understood, no?
Yeah.
So vaccine is that way. Okay. What vaccine is telling you, ki, okay, this could be the potential danger to your body. It's just making your body to remind that this is one potential danger. So
Right.
it is beneficial. Okay. Many people talk about, efficacy rate, it is 70%, it is 76% or 90% and everything. Vaccines are never developed to prevent, infection. Vaccines are developed to prevent the hospitalization or criticality. Okay. If we take example of previous diseases like polio and other things, the efficacy was 50%. Now we say that polio is eradicated.
Yeah.
Okay. Because that one-to-one transmission has stopped. You got it, no?
Yeah.
Yeah. So to answer your question, vaccination helps. Okay. If we measure benefit versus, disadvantage, benefits are much, much, much higher.
So to all of those listening, if you're not vaccinated, go get vaccinated. It's very important. Please. Yeah, I think that's all from my side.
So no, even
Okay. So we'd like to conclude by just asking for any advice that you would like to give us, gender audience, the listeners to this podcast, any piece of advice that you'd like to give to us.
Okay. I will give my advice, which was very much, aligned with your question, one of the question about the positive mindset. Okay. Now, what our elders are saying, okay, they are saying ki positive mindset, probably you may get the infection and everything, but you will not have the symptoms. Yeah. This is what they want to tell with the positive, because your immunity is up. So my last piece of advice would be regarding immunity. Okay. So how do you increase your immunity? Okay. Your immunity can be increased by stress management. Okay. You should understand how to positively manage your stress into eustress. Second, good sleep. Huh? Good sleep is very much required. Like for us doctors, we sometimes work for 36 hours in a row. But at least in a weekend, we understand sleep inertia and we can sleep better. Okay. So sleep is important. Most important, night sleep is important. Okay, for your good body. Most of the people, they don't get the night sleep. Third thing, you should think about certain nutrition also. Okay, if I'm just checking your friends, 1,000 of your friends, vitamin D and vitamin B12, you'll not be surprised that the 50% will have the lower values. Yeah. So diet is important. Okay, we do understand that we need to try different fruits and everything, food and all the life, but you need to have certain discipline. Okay, this many things I should be consuming. Okay, WHO publishes every 10 years, they publishes risk, means these were the reason and these were the diseases. Okay, क्या कारण थे और उसकी वजह से क्या disease हो गया. So they have, two sets, number of reasons, okay, risk, okay, and number of diseases. So one of the reason is always topping up, going. All the diseases are there, from the cancer to heart disease to diabetes and so many, even the communicable disease. But this one reason is going. What is that reason? It is the reason that less fiber in diet. Okay, people consume less than 200 grams of fiber in diet. That is causing so many diseases like, cancer and everything. So this could be a simple thing that you can adopt. Okay, at least have fiber, at least 200 grams. If you don't want to, you can with a spoon can eat sabji and everything. Yeah. And third thing is little bit of exercise is required. Dear friends, it is very much required. Okay, because in your body there is something called as mitochondria. They are like reactors. They are, where energy is converted. For just understanding purpose, let's say we have 1 crore of this type of mitochondria. They are in billions. But for just understanding purpose, and if you are not doing any exercise, so this 1 crore reactors will not be working. Only 10 lakhs reactor will be working. So we say na, some of the people eat or hawa khane se bhi main mota ho jata hu. It is something like that. So when you exercise, this all reactors are actually activated.
Okay.
Yeah, this remains active, and this is, a good way to increase your immunity and, push back the diseases. Yeah, thank you.
I think that was very
Yeah.
eye-opening.
Yeah.
All of the things that you stated, I feel like is really important, has been repeated many times, I think, in
Yeah.
everyone's life, but people still fail to follow them. So now you have to follow them, guys, because a
For
doctor,
all our audience.
yes, has really advised us to do so. Thank you so much, sir, for agreeing
Thank you.
to
Yeah, thank you so much.
give us so much of an insight
Thank you.
today. We did learn a lot.
Yeah,
And
it
we
was- It was a good session.
Yeah.
Just-
and we hope that our
Thank you.
audience has also been enlightened and learned so much from you today. So really, thanks a lot. We really appreciate it.
So we'll just
Thank you.
Yeah, we'll just stop recording.
Yes.
And we can